Hello, good afternoon, ladies and gentlemen. I'm your host, Agnes Henson, and today I'm going to be talking to you about the killer that could be inside you, your friend, your family member, your pet, anyone you may know. And I feel that the more people that are aware of this disease, the death rate will go down and the survival rate will go up. I'm talking about breast cancer.
This is one of the most malignant cancers in women in the United States. It can also be found in men and in your pets. I'm talking about breast cancer. Breast cancer is a kind of cancer that develops from breast cells. This cancer usually starts off in the inner lining of milk ducts, or the loops that supply the milk. There are two kinds of breast cancer. One is called invasive breast cancer, and that is when the cancer cells break out and invade nearby tissue. Then there is also non-invasive breast cancer. That is where the cancer has not broken out of its place of origin.
The first and most common signs of breast cancer is a thickening in the breast or a lump. Other signs and symptoms will be pain in the armpit area or in the breast area, pitting or redness of the skin, a rash or on a nipple, swelling of a lump, of the nipple, their discharge on the nipple, size and shape of the breast changes, the nipple skin or the breast skin have started to peel.
There are many causes of breast cancer, such as getting older, genetics, a history of breast cancer, having had certain types of breast lumps, disc breast tissue, estrogen exposure, obesity, height, alcohol consumption, radiation exposure, HRT or hormone replacement therapy, certain jobs, or even cosmetic implants. Breast cancer has become the second cause of death in American women in the last 2 decades. Every 1 in 8 women will develop invasive breast cancer in their lifetime. There are 232,340 new cases of breast cancer in women each year. Only 64,640 will be caught at its earliest form. Sadly, 39,620 women will die from breast cancer. This cancer is most common in women between the ages of 55 and 64, though most women will die at 68 from it. It's common for women who are of a Caucasian, African American, or non-Hispanic race. So how do you become a survivor and stay aware of breast cancer? There are steps you can take to survive. If it runs in your family, begin screens at least 10 years earlier than that the diagnosis of your relative. Pick a facility with a high detection rate in digital mammography. With a mammography, women should be checked every 5 to 6 years. Women with breast cancer do have treatment options, such as surgery, which is a lumpectomy, a mastectomy, or breast reconstruction. They can also do radiation therapy, chemotherapy, hormone therapy, targeted therapy, neoadjuvant therapy, or personalized medicine, such as tailoring breast cancer treatment and emerging therapy. Soy is a good source of alternative protein. Kale, sweet potato, and squash are foods that are rich in carcinogens, and it helps keep cancer cells dormant. Salmon, haddock, and cod are foods rich in omega-3 fatty acids, and this inhibits the proliferation of breast cancer cells and also reduces the progression of breast tumors. Bean and whole grains are foods that are rich in high-fiber foods. A high-fiber diet is known to boost life expectancy. A high-fiber diet keeps you full longer and decreases the number of calories consumed. The long-term effect of breast cancer could be menopause symptoms, fatigue, or pain. Treatment causes your body to change in the way you feel about your body. Treatments may cause problems if the patient is trying to get pregnant.
Is a real scary struggle. This is no joke. People with breast cancer fight to survive. 2.8 million people have survived with breast cancer already. You can be among that count too. There are always helplines, support groups, and programs to help you through this process. They can also help you pay for it as well. In closing, be aware of the changes that your body makes, no matter how big or small the changes may be. You just be aware of it and ask your doctor questions. Know the changes and be ready for it because you want to survive. At the end, here's a list of helplines that will help you in your time of need.